So, guys, we have John Kim, a nurse practitioner from Illinois, here with us today. He has a pretty big following on Instagram now. And John, can you just tell us how you got into nursing and a little bit about yourself?
Yeah, I mean, it's a funny story. I actually went to school for physical therapy, but then when I went to University of Illinois, my roommate at the time was going to become a nurse, and this was over 10 years ago. The stereotype was that men did not go into nursing. This was during like Meet the Parents era. And so when I heard that he was going into nursing, I actually like looked into it and I was like, man, this actually is a better fit for me than physical therapy. And so once I made the leap in changing my career to nursing and I got in, my roommate actually switched to business. So it was actually pretty funny. But once I got into nursing, I mean, it was, I went through nursing school, I went to grad school, and now I'm a doctor of prepared nurse practitioner. So uh, God led me through this direction, and I've been committed to it ever since.
That's pretty funny because when I went to school in Buffalo, a lot of my friends were PT majors, and then I was the only nursing major. And a similar story, like a lot of them were like, "Why are you going to nursing?" And same thing, like Gaylord Fokker and all that stuff. They're making all the jokes, but then all of them, not all of them, a good amount of them now are nurses. So it like a similar thing. I just wonder what flipped the script for a lot of people, but uh, like a lot of them did talk about that they didn't want to go like the doctoral route for PT, saying that's longer. But was that like a hindrance to you at all, or anything like that?
I think it was. I mean, I still have like a passion for physical therapy. I respect physical therapy a lot. I had a couple injuries back when I used to play sports. And so I've always admired and respected physical therapy. But I think for me, what really stood out for nursing was just the one-on-one care with people who are just really sick and who are just really at the lowest point of their lives. And you can really make a difference in their lives. And so I just like that whole communication, the relationship building aspect of nursing a little bit more than therapy. And then, yeah, that was during the time when they were changing the requirements where you had to get your doctor. And I was like, I don't want that much schooling. I just want to start working right away. So all that kind of played into factor.
Oh, for sure. And then when you went into nursing, did you have to do like a whole different prerequisites to transfer? Well, you stayed at the same school, right?
Yeah. So, I mean, the same classes I was taking for like prereqs, they were all very similar. So it was a very smooth transition. So I didn't really have to do too much.
Was it one of those like super competitive like nursing schools where you had to like apply and see if you got in kind of thing?
Yeah, absolutely. So it's the University of Illinois, but I'm a double minority because I'm Asian and a male. So I don't think I had the best like GPA or resume, but they just needed more men. So I
You're like,
think
oh,
how I got
that's him. Get him. After that's a bachelor program.
Yeah. So this one that I got into was a bachelor program.
And then did you work right after you graduated with your bachelor, or did you go straight to graduate school?
Yeah. So I worked right after graduating, and that's what I recommend too, just because I think in the MP route you see a lot of people go straight into the MP route and they're not prepared at all for the work field as a nurse practitioner. So I worked for 2 years, and the other advantage is a lot of times the hospital you work for will pay for a lot of your continuing education. And so my hospital that I worked for, I had to guarantee like 2 years of working for them, but they paid off a lot of my tuition for MP school. And it helps like if you work part-time and you go to school part-time, which is what I did for my nurse practitioner program, like you're paying off a lot of it as you go. So I think that was helpful.
So it actually like feels, well, technically is almost free because your work is paying for it. And since you're working anyway, it just feels like you're just chugging along at it.
Exactly. And I think it was a great transition from the nursing field, like understanding medical terminology, how providers take care of patients. So I think that transition's a lot better than if you go straight into MP school.
Yeah, that's a topic that I actually wanted to get into as well, because I do see a lot of new grad nurses just go straight into grad school and then um, becoming an NP. And you can definitely tell who has experience versus who doesn't. So, in my opinion, at least, as like a nurse. So, the main things for you, you're saying like the experience of you just being like at least a bedside nurse or something definitely translates the best towards the patient care at the end.
Yeah, absolutely. I think even when it comes to like getting a health history, if you get like a
Mhm.
direct admit as a nurse, you're really gathering all that information about that patient, and a lot of that is being an NP or physician assistant, like figuring out what is actually going on with the patient, and then coming up with a plan, obviously for how you're going to tackle the medical issues. And so I think a lot of it is just being able to interview and talk with patients. I think that's something you have to build up. A lot of people are naturally not good at that. And that's what the bedside experience gives you. But if you go
Mhm.
straight from nursing school straight to NP school, I will say, like, even the curriculum, like, it doesn't really prepare you for the real world, even
Mhm.
as an NP. And so a lot of what I learned was just from observing in the hospital setting and being able to see how these providers do it.
No, that's super true because uh, I said in a lot of other podcasts where I pretty much dropped out of NP school. I'm like, but I'm only like less than a year away from being done. I
Uh,
just for some reason I just at the time a lot of things was going on, and then I was like, I don't really see myself fulfilling this or
mm,
working as an NP. But I actually don't remember where I was going with that. But um, but yeah, oh yeah, the schooling. The schooling is for where I was going. At least it was just a lot of paperwork. It doesn't really translate towards, like you said, the health history and all that, and being as personable the in the workplace. I pretty much felt like I learned all my skills that if I do end up graduating with my NP degree through my clinicals and getting everything from learning from other providers more than the actual classes. And it just my thought on the education of on that end.
yeah.
But
No, I mean, I'll say, like, once I graduated, I think the majority of what I learned was during training. So I think it's also very
mhm,
important, like when you find a job, making sure there's a really good orientation process where you have a preceptor or a collaborative physician that you can work under that is willing to train you. Because if I did not have that, I would also not be prepared. I'd be overwhelmed. And, there is a lot of stuff that as you go into a specialty, family medicine or whatever, you're doing a lot of studying on your own just to get
mhm.
on top, because that's the expectation. Like when you go in and you get a job, the expectation is you're going to figure it out. And if you can't, uh, it's a cutthroat business. You're going to be let go or they're going to find someone else. And so, you have to figure out things quickly.
So what's your specialty?
So I was in family medicine for 5 years, and then I've been in sports medicine or orthopedics for about 5 years now.
Is this like your passion, the sports medicine, kind of linking the PT back in?
Yeah, I think so. I think even in family med, whenever I had a sports med patient, that'd get me super excited. Family medicine is also my passion too. I just think there's so much politics with family med, and just you get dumped on as a family medicine provider. And so I didn't really like the politics of family med, but being in a specialty is definitely a lot easier.
And are you in a clinic or you're in like a hospital setting right now?
Yeah, so I'm in the clinic. I've been in the clinic for 4 years now in sports medicine, but for a year I was a first assist for my surgeon who does
Oh, very
strictly
cool.
knee replacements. And so again, that was a whole experience where I'm just on YouTube hours a day trying to
That
figure out like how to suture and all that. Like it was an expectation that I had to figure things out on my own. And the surgeon is willing to train to a certain extent,
mhm.
but you have to be capable of figuring things out. And so it was a great experience. I think I got like really bad low back pain because it's a lot of transferring patients, holding on to patients. So I don't know if I would ever go back to it, but I'm definitely glad for the experience.
That's really cool though. The first you were a first assist for a while, and then you had to do all these extra skills. And then when I was um, in P school, one of my clinical instructors, he actually did a similar thing. And then he said when he was working with a physician, same thing. He's like, they'll train you up only to an extent. And then, like you said, you have to learn on your own. So he had to like go to all these like suturing classes and figuring out different ways to close different things to make it as packed as possible and
Mhm.
as close to like plastic surgery as you can to minimize the scarring and scar tissue and all that. So that is really cool that you went into it, and especially since I work in like a pretty much like an operating room as my current job, they pretty much treat like first assist like fellows. Like you're there the whole way and you're pretty much carrying all the way through, but then doing also the beginning and end work for the main physician.
Yeah, absolutely. And it's a lot of rounding and
Oh yeah.
being able to figure out like what meds to resume and all that. But again, it was a good experience. I think just the OR itself is such a dark place, and a lot of people feel like it seems like they don't want to be there. And then it ends up being like everything becomes so routine too. So
Mhm,
I felt like I wasn't really utilizing all my skills as an
mhm.
MP because really what I'm doing is just listening to what my surgeon wants, hand him stuff, and I'm the one who's closing the incision or the wound. So it just became really routine, and it was just a lot of physical labor. That's what it felt like.
That's true. And then so now you're in sports medicine,
Mhm.
and I see on your Instagram, mind, nutrition, fitness. And this is where you've pretty much been blowing up giving your daily fit tips and all that. What made you go into that?
Yeah. So, for me, I think we live in a world where there's so much misinformation now. And, you look around and everyone's trying to sell a product or supplement. And I think there aren't many people out there who are genuinely looking to help people, like take care of their own health and take control of their own health. And so even when I look in our healthcare world, it's really not a healthcare system; it's a sick care system, and
Mhm.
all we're doing is trying to maintain people with big pharma and these expensive treatments and procedures. And so I think for me, it's more just to be a light in this dark world. And I think for me, I really started like investing in this like a year ago, and it started off as a joke, but it gained traction pretty quick just because I think I just try to be genuine and giving information out absolutely free, unbiased. And again, do I get anything out of it? No, maybe some views, some viral videos, but I think the messages that I get like through DMs and stuff, I think that's what really has kept me going, because my motto is like, if I can really change one person's life physically, mentally, spiritually, then it's worth it for me, because I went into the field of nursing with that passion and purpose.
Yeah, that's really cool. That's why I started following you as well. And usually like my feed is usually like nursing, fitness, and also like personal finance there. And then I started seeing yours come up for like the health portions. And then I started seeing like you have kids, you're very relatable. And then some of the like the more drier humor that I feel like doesn't. So I feel like when I read the comments, sometimes people don't understand that it's like a dry humor. I'm like, really? Yeah, he's really literally making a joke here.
Yeah.
And but so I know you're saying that you don't like make any money off of like Instagram, correct?
Yeah, so I do like on the side, like some user generated content, especially for products that I do believe in, but I don't
Mhm,
like posting like the advertising kind of videos on my Instagram. So I do a lot like on the side. I'll do a
mhm.
little more sponsorship stuff on TikTok. But yeah, I mean, like through Meta, I do make money from like ad content,
That
like on a
kinda.
monthly
Mhm.
basis, stuff like that. But yeah, I'm not really going out to like sell a class on health or like to be a one-on-one health coach. Like I'm not trying to steer anything towards that with my page.
And that's what I like as well because, like, I do see a lot of nurses, any kinda, like not just nurses, any kinda healthcare professional that has some sort of following where they give health tips, they give fitness tips, and then all of a sudden, like you said, they just start trying to do the money grab of, "I'm your health coach, I'm your personal trainer, I'm something like that. Pay me and I'll give you tips," whereas you're giving a lot of them for free. You're giving a lot of good information for free. And it's a very like noble and respectable thing to do where like you said where there's just a lot of misinformation out there and a lot of people just saying whatever they want to say and trying to push that agenda.
Hmm.
So for healthcare, and since you're in the sports medicine area, this is like a topic that some of my friends that are nurse practitioners are trying to look into, like a men's health, like TRT and all that. What's your thoughts on like TRT and that?
Yeah, I think for me, it's something that I don't really deal with in sports medicine as much. I think if you look at the research, it's needed for some people, right?
Mhm.
Obviously, I think if you're using it more for performance and all that, I guess it's controversial. But yeah, I can't really speak too much of that. I think in our clinic, we do more like steroid injections or cortisone
Of
injections
course.
for obviously arthritis, rheumatoid arthritis, bad injury, stuff like that. But in family medicine, I saw it sometimes, especially for people who just naturally have low testosterone levels and stuff like that. But yeah, I don't really have much to say about that.
Yeah, because like I know it's not your specialty. I just wanted a thought on it because from seeing all the fitness content that I'm seeing lately, there's a lot of people now that are on TRT. They say they had low testosterone, but they're probably below 30. And I'm like, I'm not really sure. It could just be a diet thing on that end and not getting enough sleep, maybe not taking enough vitamins because you're just not producing as much. I was like, did you really need to go on TRT right away? I was like, I'm not sure. But it's just always been like a topic on my mind for people that are in like the health fitness industry as
Yeah.
well.
No, what I'll say is just I think a lot of problems that you're seeing just in general, low testosterone, low libido, just anxiety, depression off the roof, mental health in general. I think a lot of it is how we transition from a nutrient dense diet to more of a processed food, sugary food diet. And a lot of that is the government allows it, right? Like it's so much more affordable and it's
Mhm,
present everywhere. Like even as someone who is passionate about health, like yeah, I'll sneak a Snickers bar or like a Twix bar just because it's so convenient, right? Everything is
mhm,
right there in your hands, but that has contributed to so much of disease, including I think low testosterone, hormonal level imbalances, and all that. And so I think when we go through like to the root of everything, it's our diet is a lot worse than what it was before. We're not exercising like back in the day, when we were in middle school or elementary school, we're outside
you're
for eight
outside.
hours a day and no one, our parents aren't even looking for us because they know we're somewhere in the neighborhood. But nowadays, everyone just has a tablet. Like my kids, they just want to watch a tablet all the time and they don't want to go outside. And so we've shifted towards a more sedentary and like our diet is just god awful now. So
So you as a provider, how do you steer your patients to become more active and just eat better? Like, what are your health tips for your, patients?
yeah, so it's tough. I think a lot of patients come in with acute issues where it's like the pain needs to be addressed before you can talk about like sustainable lifestyle changes. And so oftentimes I will really focus on how everything that we're doing is temporary. It's a band-aid and it's going
Mhm,
to make you have to continue to come to the clinic over and over again. But
mhm,
I say things like, every pound that you lose, it's like 10 to 15 pounds off your knees just from 1 pound. And the more active you are, the less your joints will actually hurt. But the more sedentary you are, the more your joints will be more painful. And so just reminding them of things like that and just reminding them that food is a natural anti-inflammatory. So if you're
mhm,
eating these fresh fruits, vegetables, nuts, seeds, supplementing with things like ginger, turmeric, that's really going to help your joints naturally so that you don't need to take like ibuprofen or
mhm.
Aleve or these strong NSAIDs that wreak havoc
Like
on
your
your
stomach,
gut and
yeah,
your stomach,
yeah.
right? And so I think just reminding them of those things, it's tough because a lot of people just want the quick solution, right? The quick
Yes.
fix. And so even when I recommend physical therapy, a lot of them like, oh, physical therapy doesn't work. But the thing is, it's like it takes a lot of time for you to get to where you're at health wise with all the
Mhm,
negative effects. And it's the same thing. Like if you want to recover and get on top of your health, it's going to take a lot of time, commitment, sacrifice. And so in this kind of world we live in where it's fast paced and everyone wants quick results, it's tough to convince people of that.
yeah, especially like you were just talking about, it's just the Band-Aid. If they don't wanna make 1 pound adjustment or try to get that weight off, you're just going to keep coming back for the same thing over and over again. And I really like how you said like, oh, just 1 pound is 15 pounds. And then I see on your Instagram here, it's like, oh, you're obese, you're fat. Like, so obviously you say it way nicer in the clinic, but
Oh, yeah,
for like the patients that you see over and over again, how like I just wonder how can you get it more straight to them? Like you don't want to be rude and be like, hey, you're obese. You gotta lose the weight because obviously then it's still at the end of the day a business and they stop coming to the clinic. That takes away revenue from the clinic. So like
sure.
how could you do something to get the point across better if just people aren't willing to take those subtle hints that hey, you got to lose weight or you got to eat better.
Yeah. Well, at the end of the day, like if my patient's getting better and they don't come back to the clinic, like I could care less if my clinic's getting revenue, right? So ultimately, I'm more for the patient than my actual
Mhm.
clinic. But um, it's all about just relationship building, building that trust, and showing them like, look, I genuinely do care about your health, and obviously at the end of the day, I can only do what I can do to help them. They're gonna have to look in the mirror and be like, look, things need to change. It's time to take control because I think a lot of times health providers can end up being a scapegoat too. Like you try to do your
Mhm.
best to help them, and they're not seeing results, and they get upset at you. But I think it has to come to a point where patients learn to take accountability, and they look at themselves and say, look, this it's my lifestyle choices I made on a daily basis. And so I'm just there to try to guide them and coach them into that direction. And so, as I built relationships with patients, I can be a little more blunt with some of them and be like, listen, you have a lot of pain. You know why? Like, you're not eating well, you're not exercising. Like, I don't have to tell you all this. You already know it, but are you going to do
Do
something
it.
about it? Because, yes, I can maintain your pain. I can help maintain like your health as long as you want, but is that really doing a service for you? So you make the choice. Like, I can be here to do that for you, or I can push you into taking care of your own health. So I will be there in whatever you choose, but hear me out. I want you to take control of your own health.
And with that as well, like I know a lot of providers are similar to you where you really want to help the patients and hopefully get them off medications. Is that like a thought when you talk to your patient? Like you might not need to be on so many medications if you take care of your health a little bit better, and then we could slowly start taking it off one by one to see where you're actually at.
Yeah, so I'd say that was probably more my mentality when I was in family med.
Oh
I had
yeah.
built relationships over the years with a lot of these patients, and just to even like compare lab results, like a hemoglobin A1C, and say, look, just from your diet and exercise, you went from like 10 down to like an 8. Like that's all you. Yes, big pharma meds have kept you controlled and have maintained, but just from your lifestyle changes, you've done it. Like kudos to you, right? And so there are a lot of celebrations, little victories like that, and then being able to take patients off meds. Yeah, it was very rewarding, and they felt better too. Every med that you're off, it's like less adverse effects, side effects, and drug interactions. And so that's ultimately the goal. But again, I think with how healthcare is, where you get like 15 to 20 minutes with patients, you really don't have that time to like even try to convince them. It's like you're in and you're out. And then not only are you taking care of patients, you're dealing with telephone encounters, in
Mhm.
basket stuff, nurse messages. So it gets overwhelming. And that's why, again, family medicine, I think it was just really difficult in the sense that you are there with that purpose of trying to reverse chronic diseases for these patients, but you don't have the tools or the environment to do it, unfortunately.
And was that a reason why you switched over to like the sports medicine route that you're in now?
Yeah, completely. And the clinic I worked at was pretty toxic too. Like our medical director just did not like nurse practitioners or physician's assistants. So it was just very degrading to be even around her. She
Mm.
had really no respect. But with that said, I definitely enjoyed my patient population.
And since you just went into it, I see it all the time too. Why do you think certain medical directors or doctors just don't like NPs and PAs?
Yeah, it's funny because even on TikTok, I made a video about like walking into a patient's room and the patient wanted a second opinion because I'm a nurse practitioner, so they wanted me to collaborate with the physician, and then I pretend like it's all a joke, but I pretend like I go up to my provider to talk, but then I end up just like doing my own thing, and I come back and I say, yeah, the doctor agrees with me because it's just a basic diagnosis, right? I
Mhm,
remember after that video, so many doctors got so upset. Like my comment section blew up, and they actually made a Reddit discussion post about my video. And ultimately, it came down to where my clinic was notified of this video, and then so they made me actually put it down or take it down. And so I looked at that, and it just humbly reminded me again, like as a nurse practitioner, yes, we have a lot less schooling. And I just want to say, like, I highly respect physicians, medical
mhm,
doctors, and my supervising physician, I absolutely love and respect. With that said, I think with how NPs and PAs are kind of slowly, taking over, they're getting a lot more respect
and
in the
autonomy.
United States. Yeah, autonomy and all that. I think like old school medical doctors, as they see that, they're like, why is that the case? Like that should not be the case at all. And I think in the medical field, just so many doctors are just burnt out, right? So they went
Mhm,
through all that schooling, all those years, and they're really not seeing much difference with their patient load either, right? And
mhm,
so, and they're having almost like midlife or career crisis. Like, why did I go into this field if like PAs and NPs are getting like the same kind of outcomes that we're getting? And we've been in this field for a long time. So I don't know. I think there's just a lot of medical doctors who they look, they frown upon or look down upon PAs and NPs just because they're like, they lack so much education. How are they practicing with so much autonomy? But I really believe it's the doctors who work alongside with MPs and PAs that actually have a natural respect for
mhm,
advanced care providers or advanced practice providers because they see, yeah, we're all part of a team. And that's how I always saw it. Like I would never assume that, I'm by myself, but I always have a backup collaborative physician just in
mhm.
case I have a complex or difficult patient that I don't know what to do with. And so I always saw it more as a team thing, whereas I think a lot of medical doctors are maybe threatened by the profession. I have no idea though.
Yeah. I just talked about it with a CRNA that I just interviewed last week, and I didn't know in Wisconsin that CRNAs could practice completely independently, and they don't need any um, attending around near them, even when he's like, and he's the only anesthesia provider in that critical access hospital. So I didn't know that CRNAs in specific states could fully practice without any anesthesiologist provider there.
Yeah.
And then like I posted like a little video on it, and then I got messages from anesthesiologists being like, that shouldn't happen. What if something bad happens? And then he's the only provider. I was like, obviously he also had a lot of training, a lot of schooling.
Mhm.
He might not have went through a medical program, but he went through graduate CRNA school, and that's pretty intensive as well. And he also did a lot of did a lot of his clinicals and worked in major hospitals before he took a critical access job. So it's just like you said, I think it might just be more closed-minded physicians looking at it and be like, "Oh my god, you're taking over our jobs," but also at the same time, from what Josh is his name, what he was saying, he's like, not a lot of these anesthesiologists or even physicians want to work in these more remote places.
Exactly.
So there's a space for advanced practice nurses, PAs to do a very high level, high scope, high level job within their scope to
Mhm.
and provide the best care.
Yeah, there's a huge shortage just throughout, and that was the whole purpose of MPs and PAs to kind of fill the gap.
Yeah.
So we're just trying to help out ultimately, and so like I do not look at myself as superior to a doctor,
Hmm.
and and I don't. expect them to treat me as like an equal either. Like I just, we're all part of a team. And I think when it works, when that's that perspective that it's a team healthcare model, that's when we can give the best care to the patients.
And I think that's the thing. That might be the disconnect, because I just from seeing it, I work with so many PAs, a lot of attendings, and then I don't think it's the thought about being seen as an equal. I think like you were talking about, like obviously the schooling is different, but I think the thought is that NPs, PAs, nurses, they just want their respect too. That's really it. That you're there. Just we're a part of the team. We're here to help the patient at the end of the day.
Exactly.
And then let's go into sports medicine. What brought you fully into it? I know we touched upon it, but I just keep going on tangents here. And then
Yeah. So I think for me, again, I was kind of trying to figure out a way out of family med, and then the opportunity came first for this first assist position. And
mhm,
so again, obviously it was overwhelming because I didn't have the credentials, and like the MP route itself, if you go to school, you really don't get the experience, clinical hours in like surgery, rotation, or
yeah,
any other
at all.
specialty. Like NP schools are designed to get you ready for primary care.
Yeah.
And so even when I applied for the job and they actually accepted me, it was a lot of like figuring things out on my own, a lot of YouTube, a lot of just asking my own mentors who were in the ortho realm. And so that's kind of how I got into it. It just worked out really well because the surgeon that needed someone had just started as well. So the timing could not have been more perfect. But I think that's a lot of what MP and PA is about, like finding those opportunities. And I think in the beginning, when you first start, you really just can't be picky. You got to find a job, get that experience. And it's once you have experience that you're able to find jobs that you actually want. And so, with the 5 years of family med experience, that allowed me to get what I ultimately wanted.
Yeah. It opened up a lot of doors for you.
Exactly.
And then so what exactly is your role at the clinic that you're at now?
Yeah. So, talking about autonomy, there are days where I'm by myself, like in the clinic, right? So, it's a pretty big clinic. We have, I think, four other advanced practice providers. So, like, uh, and they're all kind of in and out, but it's a mix of physician assistants and nurse practitioners. But
Hmm.
basically, I have my own schedule, right? I see anywhere between like 15, 25 patients, and it's a lot of arthritis, fracture care, um, any kind of like sports medicine related injuries. So, like ankle sprains, low back sprains, different things like that. But it's a lot of injections ultimately. Like people come in, get either visco supplementation or steroid injections,
Hmm.
whether it's the shoulders, hips, the knees. And so it's a pretty busy clinic, especially like when it's a really bad weather, like a lot of
Oh
snow.
yeah.
We get a lot of falls, and so a lot of fracture care. But yeah, that's essentially it. Just a lot of sports and joint related issues.
And is this like a spot that you see yourself like staying in for the long run because you like it there?
Yeah, I think so. I think quality of life is awesome. Like I never go home late. It's a very chill. Like spending like 15, 25 patients in this clinic would be equivalent to seeing maybe like 40 patients in family med. Like I felt like when I was in family med, seeing even like 15 patients was kind of rough because they have multiple issues and you,
Hmm.
you have to really try to address it within like 15, 20 minutes. In sports med, it's like one issue and you can address it in like 5 to 10 minutes. And so the complexity is a lot different. And it's definitely a lot less stressful because if they have other issues, all you have to say is like you need to go back to your primary
Yeah,
care.
you got to refer
Right.
back your
Yeah.
primary care.
Yeah. Yeah. So
You're
I
you're
mean,
spe- you're super specialized there now.
exactly. And so that's where specialty is nice. You just target one thing.
And then I don't know, I just blanked out. I had a great question for you. But so what is your schedule like now, since you said you got to make your own schedule?
Yeah. So I mean, I work every day. I'm like not considered full time, full time. I'm like, I work maybe like 30, 35 hours. Just because, again, I do like the user generated content. I have a side business. So I mean, all that stuff. But yeah, So I work maybe like 6 hours, 5, 6 hours a day.
That's awesome. And then that's why you're able to hang out with your kids at home and all that as well.
Oh, exactly. But yeah, they still go to daycare. But yeah, yeah, definitely. I mean, that's one thing that I love about being an MP is just the work-life balance. There's
Mhm,
such good work-life balance. I don't have to be on call. I don't have to do around anymore. Like I'm just straight up in the clinic. Once I'm done, I'm
mhm.
done. And for the rest of the time, I could just spend with my family. And so it's a really nice gig for anyone who definitely wants to go in.
That's really solid. So you also touched upon businesses. What other, businesses do you have? If you
Yeah,
wanna go into it.
so I do the user generated content on the side. I also it's more of like eh, it's a stock option business, but it's more for like passive income. So like I run a Discord, it has over 200 members, and it's more so just how to if you own stocks, like how to
Covered
passively make
calls and cash secured puts?
exactly, yeah, stuff like that. And so that's been going on for, I want to say like 4 years now.
Nice. I'm a finance geek. Before I switched over this YouTube channel to a nursing, podcast channel, this used to be a personal finance stocks and crypto TA
Oh,
channel.
nice.
That's why there's like 24,000 subs on it. So, I love that you just said that. You just, like, made me, like, super happy. So, do you said it started 4 years ago. When did you start getting into options or investing?
So I think for me, ultimately, you're just trying to because you don't get a lot of education about it, right? I
At
think in
all?
high school and stuff,
And
like
definitely not in nursing school.
exactly. And so it was more so I think a couple of my friends got into it, and then I started researching it on my own, and even hearing about like Warren Buffett, how he'll sell like cash secured puts
Yeah,
to get a better entry into a lot of different stocks that he wants. Like when you figure it out and you learn it, you realize, man, this is like really a hidden gem that many people don't share. Obviously, like if you're doing straight options, is it a gamble? Absolutely.
100%.
Like you can make a lot, but you also lose a lot. But I think if you're doing it passively, especially like if you have a great career and you have that income where you can kind of build on that, like there are so many strategies that you can use to ultimately build up your wealth. And
100%.
so I think it's something that everyone should learn. And ultimately, my main motivation is, I want to build up finances for my kids, like as they grow up, so
Mhm,
they don't have to worry. Because I grew up um, as a pastor's kid. And so we didn't have much income. I had to figure things
mhm,
out. Like when I was in college, I had to work like these
mhm.
part-time jobs all the time to just help pay off my tuition. So, it's extremely stressful. And so I think this was my way of kind of being proactive and like, if I want to get out of this rat race, like I need to figure things out myself.
Yeah, and I talk about this all the time with other nurses because I'm one of the, I guess, the financially literate ones in the unit or whatever, and they come up to me, it's like, How do I invest, or how do I not feel so drained coming into work knowing that I'm gonna do this for, like, 30, 40 years until I'm, like, 65?" I was like, "Well, first you gotta invest, learn basics, but then when you have a little bit of money in there, there's a lot of strategies that you could supplement your income with, and this is one of them." Like, for me, I like focusing on cash secured puts, covered calls, and a little bit of doing leaps.
Mhm.
And those, like you said, it's a hidden gem, and it's not hard to learn, and you could still capitalize on upswings, and you could still make a lot of money on downswings in the market. So, it's similarly to you. I'm doing this to make sure I could provide the most for my family and also make sure my kids are gonna be well taken care of in the future.
Exactly. And I think the stigma is like, oh, investing is so risky and all that. But
Mhm.
again, it's just finding out kind of what you can tolerate because there's so many different ways to do it. And that's the crazy thing. Everyone thinks it's just like a cookie cutter one way, but no, absolutely not. Like there are so many different methods and strategies. And yeah, it's your risk tolerance
Yeah,
ultimately.
especially when I bring up just the word options. to anyone that knows a little bit about like basic stock market knowledge, and then all of a sudden, nope, I don't want to hear it, too risky. I'm like,
Mhm.
just hear me out. I could teach you this in 15 minutes and you could do weekly income here.
Exactly.
And then you won't have to show up for overtime and slave
Mhm.
yourself for 12 hours, because depending on your portfolio, you can make $1,000 a week for 10 minutes of work. And they think it's like fake. They
Yeah, or like a
think
scam
a
and
scam.
what.
I'm like,
Mhm.
I was like, no, it's literally the market makers are going to pay you. That's really it.
Yeah, because at the end of the day, I think they say, majority of options expire worthless. So if you become a
Hmm.
seller, a premium seller, which is ultimately like
The goal.
what I think is the best way to do it,
Hmm.
like majority of the times you're gonna be making money.
Yeah. This is really cool that we went into this because you post zero about this.
Yeah,
Do
again, yeah, I don't advertise it or anything like
I?
that, but yeah.
But so for your kids, for making accounts for your kids, do you have custodial accounts and like a 529 for them?
Yeah, so I have a 529. Ultimately, I think once they get older, uh, yeah, I'll probably do like a brokerage account for
Mm,
both of them, and then I'll just tell them to just let it sit.
yeah.
As long as they want me to, I'll manage it for them. Um, and ultimately, again, even the 529, like the way this world is going, like who knows if college is even gonna
Hmm.
be something that they want to do, because ultimately a lot of people are going to college and not even finding
Using it.
jobs afterwards.
Yep.
And so I have it just in case, but yeah, ultimately, again, I kind of learned this just so I can teach them as they get older. And, obviously this is kind of like, not to, put it like a stigma on it, but a lot of the Indian folk do this, right? Like this is how they gain generational wealth. And it's just, again, like a hidden gem that many people just don't understand. Like it can make you that supplemental income, but as you continue to grow that account, like it can
Mhm.
actually transition to where you're just doing this full time.
Oh, 100%. I don't know if you said you watch a lot of YouTube. I'm sure you do. There's a
Hmm.
YouTuber, Invest with Henry. He does he pretty much teaches covered calls, cash ticket puts, and shows that like off like a $40,000 account, you could be making 1,200 a week. Or
Exactly.
70,000 account, you're making $3,000 to $4,000 a week. And then he's like, if you want full financial independence and if you want to live somewhere, and if you don't want to live lavishly, all you need is like maybe like $200,000 account and you could live pretty much off that. But if you want to live how he's living in Dubai or whatever, like it's like 710 plus, he said, is the
Geez.
number.
Hmm.
And then with that, he said he was making like close to 15K, 7 to 20K a week. I was like, what the and uh, and the thing is, I believe it. If you because it's all numbers on a screen. Like you could see the premium that you're gonna get. Of
Exactly.
course, you always bank on it because of market volatility? No, not that high of a premium, but you could still make a significant amount that you can eventually do it full time and leave your W-2 job and that's like the goal.
Yeah. No, ultimately, yeah. But again, it's something that many people just don't know or are not educated about.
And is the goal for you, as a nurse practitioner, to stay working until like 65, like or 70, whatever the government says the new retirement age is?
Yeah, so ultimately, this is one of my passions. It's something that I feel like I would never leave.
Mhm.
Like, yeah, if it came to a point where I felt like this is just a job that I'm trying to get through, I would already have quit. But like, I think if I just did my side business full time, like, I don't think I would find real purpose or value
Mm.
in it. So this is kind of where I find my purpose, and I've always had, I don't know, in me like compassion for people who need the help, and so as long as I can do it, I'll definitely keep doing this.
And for your kids, a lot of people ask me this question. Would you, if your kids wanted to be nurses, would you
Let
steer them
them.
any other way? Yeah.
So I'd say actually, if they said that they wanted to go and become a doctor, I would try to steer them away. Um, especially because yeah, I say like unless you are 100% like motivated that this is your vision and purpose in life, like there are going to be so many ups and downs, especially in our healthcare world today. And so I would
Mhm,
actually push them to be an NP or PA, especially if they want more of a work-life balance. And with nursing, I think there's just so much, it's hit or miss, right? It really depends on what kind of floor you work on and your team. Like when I was a nurse, I actually had the privilege of working with like some of the best team-based nurses, like team
mhm,
mindset nurses. And so I never had like the experience that many nurses have, of, like the nurses eating their young or like the
mhm,
burnout. And so my nursing experience was amazing. I just hated working 12-hour shifts,
mhm.
but yeah, I never really had like any ill feelings towards like my nursing career. I actually enjoyed it. I just wanted to advance my education. So if they want to go that route, I would certainly say yes. But if they want to do NP or PA and they were not a nursing background, I would actually really push them to do physician assistant.
Really?
Yeah, I think the nurse practitioner route works a lot better if you're a nurse already,
Oh,
just
okay, yeah.
because of that transition. But I think physician assistant, the schooling wise, I think you're much better prepared once you graduate. And you can really, the door is open for all these different specialties because you get all these hours in your rotations. But as an NP, again, like my main focus was on family medicine. And so I was really just narrow focused there, like where I can only choose primary care when I graduated.
That's actually been a topic of discussion for me because I keep every time like winter comes around, I go into like this rut of be like, I'm so close to being done. Should I just finish the program? But the specialty I'm in is FNP.
Hmm.
And so it's like family. And then I'm like, oh, would I use it? Am I just going to be strictly in primary care or like at urgent care? Like I do see in the hospital I work at, they hire FNPs for where I'm at in the cath EP lab
Hmm.
to help with that. But if I left New York, where am I going to be pigeonholed into kind of thing? And that's where like there's like a struggle in my mind. Am I marketable to the specialties that I would potentially want to go into?
Yeah. Well, so I think the good news is just FNP is such a broad,
Yeah.
yeah, like degree or title that you can actually get into any specialty. And one thing I actually recommend to people who are going into it, I have a lot of people who go into like peds nurse practitioner or women's nurse practitioner. And I
Mhm.
say, no, don't do that because if you graduate and you want something else, you can't because your title is specifically that. So you're stuck in peds or you're stuck in women's. But as a family nurse practitioner, it opens you up to everything where
Mm.
you can work in derm or you can do surgery or whatever. But if you specialize early on and then you get that title, because of the law, you really can't do anything else.
I was looking at it a totally different way. I really appreciate you shining that light on there.
Yeah, so family is just a very general term, and as long as you have a physician who's willing to train you, you can go into any specialty that you want.
Dang. And we're going on almost an hour here. So if there's anyone that wanted to go the NP route, what would you tell them to do, even though you kind of touched on it earlier?
I say be a nurse first. I think there are a lot of nursing programs that kind of bridge into the NP program, and so if you want strictly to go to that NP route, do that nursing route first. And I think even now, like if you're much older, they have like that master's nursing program where then it's a bridge into your doctorate. Because nowadays, a lot of these schools are getting rid of the master's nurse practitioner
Mhm.
program and going straight to the doctorate, which I don't really agree with either, but that is kind of how the direction's going. But as an MP, the best way is just become a nurse first and do it through that.
That's what I wanted to. So, did you have a master's first, or you went straight into your doctorate program?
Yeah, so I had my master's and then I did like this accelerated doctorate program. And I will say, like, even with my doctorate program, I do not feel like I'm a better provider because of it. The doctorate program was actually more focused on research and doing like
Mhm.
quality improvement projects. So I honestly thought it was a waste of time. I ultimately got my doctorate because if the trend changes where they make it like, oh, the standard
The
is you have your
standard.
doctorate, kind of like how associate prepared nurses, yeah, they still do a great job, but then the expectation is they're going to go back to school and get their bachelor's. So
Mhm.
ultimately, that's kind of like why, because they've been trying to push for nurse practitioner to be doctor for a while now.
Yeah.
And so that's ultimately why I got it. And plus, I teach at the University of Illinois as well. And so by having my doctorate, I can even teach grad school if I wanted to.
Oh, so I like it. Forward thinking, keep the doors open, opportunities.
Exactly. And then, like, yeah, once I'm done with practice, maybe I'll become like a part time faculty or something in the nursing program.
Perfect. And John, if anyone wanted to contact you, how would they get in contact with you?
Yeah, I mean, you can shoot me a DM on
Exactly what
Instagram.
I did.
Yeah, I have my email on Instagram as well, but I'm very friendly. Like I think people message me all the time, and yeah, I appreciate it. Like I try to stay humble. Like I'm just you're a very or like normal person. Like even for me to kind of grow my Instagram how I did, it's just about consistency. That's all Instagram wants. Like if you're consistent on a daily basis, you just slowly gain followers because Instagram, the algo just rewards you for all that. And so I think if you have like something that you're passionate about and you consistently post, like you're gonna notice like growth if you want to go that direction too. But yeah, you can always shoot me a message. Happy to respond there.
Perfect. Thanks, John, so much for hanging out with me and talking about being a provider,
Yeah.
going family medicine, sports medicine, and then finding out that you're just like me. You just love doing some stock options.
Yeah, I mean, it's definitely a passion of mine too, just being able to look at the stock market every day. Like and it humbles you too,
Oh,
obviously, because you think you know the direction that companies are going or the stock market's going, and every day it's totally different. So it's definitely a hobby that will keep you engaged, and you have to learn every single day for sure.
perfect. Thanks again, man. I hope you have a great weekend, and I'll send this to you when I'm done editing it.
Awesome, man. All right, take care.
Take care.